Hello, and welcome to another episode of JRPG. On this episode of JRPG, we will be covering gaming and medicine. I was inspired by this topic because recently I was in a car accident and had to go to the hospital. While at the hospital, I saw a Wii station for people to play while they were staying there. In doing some research, I found that gaming has played a large part in medicine. Whether pre-existing games were incorporated for medical needs, or games that were specifically designed to assist people with certain special needs, this episode will talk about the various ways that gaming has played a part in medicine. Video gaming has played a large part in medicine over the years, and throughout time it's done nothing but grow. These two topics may not seem like they belong together, but with the development of technology for consoles like the Kinect and the Wii, great strides have been taken in medicine using video game consoles, games, and accessories. Whether you may be a skeptic or not, numerous people have created video games and technology for use in the medical field, and for the most part it has benefited the people who may need it most. These are instances where video games have been developed for the public but later utilized in the medical field.
Super Monkey Ball was used to test the efficiency of surgical doctors. Florida Hospital Celebration Health conducted a series of tests where over 300 physicians played Super Monkey Ball 2 before performing simulated surgery. Dr. James Rosser found that doctors who warmed up with the game were more efficient and less prone to errors. Surgeons who played video games more than 3 hours per week made 37% fewer errors, were 27% faster, and scored 26% higher overall than surgeons who had never played video games before. Tetris is used to help people cope with PTSD. I personally can attest to this. I decided to keep Tetris on my phone so that in those rare occurrences when traffic incidents take place, you can play Tetris and it will ease your mind and calm your nerves.
I actually did this at the scene of the accident that I mentioned earlier to help with the amount of shock that I was in.
Brain age has been used in medical studies to help people who have Alzheimer's disease to help retrain their memory. Wii Fit has been used for stroke victims and people diagnosed with Parkinson's disease to retrain the balance in their bodies. The Kinect is trying to be used in assisting doctors with x-rays. They want to utilize the tech to have more accurate readouts while movement occurs during an x-ray, as well as using it to measure thickness of body tissue.
Sometimes circumstances are unique, and not everybody can be helped by the same system. A lot of these entries have had people who may have developed themselves or partnered with other people to develop a video game used specifically in the medical field to assist the people who need it.
There have also been some games developed to train doctors, like simulators, for example.
Some of these entries may also be ways of the future that will further healing in people in use of medicinally developed video games.
A YouTuber doctor named Andrew Wright had a seminar where he had mentioned several ways video games have contributed to medicine and listed off a few ways games, apps, and more are being developed to further help people with medical needs. Snow World is a game developed to help burn victims deal with the trauma and pain of their injury by playing a game fully immersed in an Arctic land. In Snow World, you throw snowballs at penguins and snowmen while listening to some relaxing tunes. This cold atmosphere also tricks the brain and allows you to believe that you are in a frigid land to dull the burning pain. Patients have reported less pain while playing this game during their treatments, and MRIs report that there is less pain signals being sent in the brain relating to the burns while playing. Touch Surgery is an app that allows doctors to rehearse procedures and techniques with one touch to get a refresher before the surgery. This app can also be used by patients who may undergo a certain surgery where they will not be awake or able to see, and this way they can get an idea of what will happen and be prepared for their surgery.
Younger generations of microsurgeons tend to surpass the expectations and standards set by the older generations in levels of skill, accuracy, speed, and hand-eye coordination. This is believed to be because the younger generation grew up playing video games.
On a segment from TED Talks Montreal entitled Video Games for Better Medical Rehabilitation, Justin Tan talks about a new kind of technological therapy he and his colleagues developed. They developed Gintronics, which is a motion capture medical rehabilitation using devices like the Kinect and uses routines approved by physical and occupational therapists as games to help people with their treatments and give them their medical network allows medical minds to prescribe therapy software based on their needs. This network also allows the doctors to track their patients' progress, as well as allowing the family to see how far their loved one has come and motivate them further. A game called Project Evo is being developed to help people with ADHD, autism, and depression, and may also assist in diagnosing Alzheimer's. The development team partnered with Pfizer Drug Company to work on the game, and they hope to submit it to the FDA as an alternative to medicine. I Am Dolphin is a game being developed to be used to help stroke victims reverse the effects of a stroke and allow them to recover and retain some of their previous strength and motor skills instead of learning to live without it. UBISOFT developed a game called Dig Rush for tablets, and it has blue and red characters on the screen. While you play, you wear 3D glasses, and it helps children with amblyopia, also known as lazy eye. You need a prescription to play this game. 90% of patients who use similar treatment saw improvement in as little as 4 to 6 weeks. Key Breath is a French game that was being developed to help children with cystic fibrosis. If they do not do their breathing exercises, it can cut their life expectancy by up to 2 to 3 times. This game allows them to use their breathing while using a special spirometer to play the game. Physical therapists can use an application to interact with the child's game to make it more difficult to push them or easier if it's too hard. It also gives them a readout of analysis about the child's breathing habits. Virtual Heroes is a combat medic trainer 3D simulation game used to train the military in on-the-battlefield procedures. It also shows a comparison of previous field attempts and is more realistic, unlike games made as joke simulators like Surgeon Simulator. Another game similar to this is a simulator used to teach paramedics and resuscitation techniques.
These entries are ways that the gaming industry has evolved and been able to address people's special needs. While some may be unintentional, these next facts have contributed to allowing people to play video games that otherwise may not be able to.
The PlayStation 4 allows games to have custom controls via button remapping. If you needed to play with one hand, this could be a solution. The Wii is a perfect console for people who may be handicapped, as it only uses one hand to play at times and in most games. This just goes to show how far controllers have come to where you can play an entire game using only one hand. The Nintendo Entertainment System had a controller called the Hands Free for people who may not be able to use their hands. It allowed the player to move their head and suck and blow into the mouthpiece to operate the game. Games like Destiny, Puzzle and Dragons, and Borderlands 2 have recently included colorblind features in games to help people with colorblindness to be able to equally enjoy video games without issue. Some games have also refrained from using certain clashing colors for this reason.
Different gaming charities have been formed over the years to help raise money to aid people in need. Lastly, we'll take a look at a brief glimpse at a few of these gaming charities that are around now.
Child's Play was founded by the Penny Arcade creators. It's an organization made to donate video games and consoles to hospitals to provide a release from the happenings in the hospital and to help them get better. Extra Life is a charity that organizes players to marathon a 24-hour gaming session and is sponsored by their game playing. All donations go to the Children's Miracle Network of hospitals.
Throwing back to the importance of adaptable gaming mentioned in the previous section,
Special Effects is a British gaming charity which focuses on finding adaptable controllers for some that may have special needs so they can enjoy playing video games. These adaptable controllers allow the people they are designed for to do what most people do when they play video games. It allows a way of escape from the problems and limitations of everyday life. Another British charity, Games Aid, raises money for children, but instead of raising money through game-centric events, people from the gaming industry itself donate their time to this charity's cause. Starlight and Nintendo partnered together to donate Nintendo consoles to hospitals for kids and families, that way they can play together. The Wii I mentioned earlier at the beginning of this video was from that foundation. The Humble Bundle is a website that sells bundles of games for their famous pay what you want price, and proceeds typically are used in the charities I mentioned prior.
So what did you guys think? I hope you learned a few things from this video about the roles video games have played in medicine. My real purpose of this video was to raise awareness of how much of a big deal video games are for people who may need a different way of treatment, and how video games can impact the medical field. I really wanted to do this video because I don't feel that a lot of this information is compiled in one centralized place about this particular topic. I hope that this video did its job in informing you and all the roles that video games has played in medicine. And who knows how much of a big role video games will play in the future of medicine. Thanks everyone for watching, and I'll see you next video.